Hey Cam followers, we are back. This lady is cool. So we've been just chatting for the last 20 minutes. There's been puppets appearing from everywhere. So please meet Dr. Narda Robinson, who is giving up her time to come and talk to us about something that's really, really quite important. I'm going to let her introduce herself before we then get into the topic. So Narda, please tell us about yourself. Give us a history, what you're up to.
Sure. Yeah. So I am a human physician as well as a veterinarian. And so I was and still am the human physician first, but then always wanted to go to vet school and work with animals. So I did that after a few years in practice. And probably about my third year at Colorado State University, I just recommended to the faculty that we start an acupuncture service for animals because I was already treating a bunch of the faculty and administrators in my human practice, and they were getting better. And so they could see that this was meaningful and I could explain it scientifically. And I just saw all these animals in the waiting area at the hospital that could, if they were humans, I knew that they would benefit or had a big likelihood to benefit from acupuncture. So they let me get started. And then I just stayed at CSU for the next 20 years on staff. And I started the integrative medicine service and the Center for Comparative Pain Medicine. So for the last 4 years or so, I've just been working through my teaching organizations, Curacore Vet, and then for the human Curacore Med. And I have a strictly scientific approach to integrative medicine. And we started our medical acupuncture courses back in '98. So we've been doing it for a long time. And so that's why I'm really happy to be here today, because all the species anyways, but the small animal population especially, they have a lot of options that I think that veterinarians sometimes either don't know about or just are suspicious about because it's not been described scientifically. And so I think it's good to have a critical eye, but I think that we as integrative medicine practitioners and veterinarians need to be able to explain what we do and how it works and why, or there are some things that maybe shouldn't be practiced. So I'm a little bit of an outlier in some of the integrative medicine circles because there are things that I critique and question, and then I'll also question like the mainstream approaches sometimes if I feel and see the evidence that there are integrative approaches that might offer safer, maybe more effective approach. And so ultimately it's what's best for the animal, what's best also for the person who cares for them, what makes the most sense. I mean, we only have a certain amount of emotional and financial and health recovery resources. So let's not drain them all with things that might be injurious or don't work, whatever the therapy is.
Yeah. No, this is I actually heard you lecture from the online pet health platform. I was like, oh my God, I've got to get my hands on that.
Oh, well, thanks. Yeah, I've heard a lot about you too, so I'm so happy to meet you.
Well, what I loved about when you lecture, you're really passionate about it, but you're very humble about it as well. And I think that's just such a good stance, especially in front of clients as well. I think it's really important. So the reason that I got in touch with Narda, so you guys know the connection with osteoarthritis, is we have a platform called Holly's Army, which is an owner-focused kind of like community group. And we've obviously got quite a big presence now on Facebook. And we see a lot of people putting photos and videos of their dogs that have a diagnosis of osteoarthritis. And you're watching them walking going, I'm not convinced. There's something else going on there. We've got a very, very stiff, rigid gait. We've got a really stiff back. We've maybe got some, toe drag. We've got some proprioceptive deficits where they don't exactly have good placement. It's a bit irregular. And you're sitting there going, oh my God, I need to have this conversation with somebody, how being stiff and being slow is not necessarily osteoarthritis. And people have to open their mind to the fact that there can be other possibilities. One of them is spinal related problems. So this is why she's here. So do you kind of agree? Do you see that a lot where they're just labeled as, oh, it must be arthritis? And you're like, no.
Yeah, I absolutely do see that quite a bit. And it seems to me like that's just the easy way out is to just say, oh, they have bad hips. I mean, even to the point that whoever it is might say, oh yeah, I know that that's such and such. But if imaging and all that was just free and completely safe and everything, then if we always went and then took a radiograph and verified that, that would help to sometimes dispel the mistaken notion that it's this or that joint or all these joints. But that probably doesn't happen. But yeah, there are so many reasons that animals could be stiff and look sore. But even if they have osteoarthritis, that where is it? What joint? How many? And is that really the source of pain? I mean, a lot of us can have changes in our structure, but it never manifests clinically. But if you had some kind of nerve compression or spinal cord compression, it actually changes the way that you walk, either because you're compensating for pain in a certain place, or because it's changing the behavior of your nervous system such that it becomes stiff and rigid. And it's really sad that that when a dog or cat or horse or whatever, when they don't get a good diagnosis, because that can lead to the treatments that are wrong and very expensive, maybe harmful. And I think that's such a problem that I emphasize to my students, that we need to spend much more time on the diagnosis, and we need to have a hands-on approach and take some time with it. And just if you only have 5 minutes or 10 minutes, that's, to me, not enough. And so we, at least in the US, I mean, we can do mobile practice, and we can set our own times if we want, like, versus the maybe different types of practice that squeeze you into a short
time.
We
have that over here. We have the average consult time in the UK is between 10 and 15 minutes. Yeah. And when you think what has to be achieved in that time, it's pretty spectacular. Right. So you've got to have the owner leave the waiting room, come into the room, be greeted. The animal's got to settle. You've got to take the history. You're trying to type your notes. You're trying to look at the animal. You've got to palpate the animal. You've got to process the information. You've got to dispense the medication. You've got to type up your notes. You go to the next one. And you're like, wow. So yeah, here in the UK, I think we do have that as a disadvantage. But another reason, I just wanted to step back a bit. It's not just seeing these video clips and these photos that are making me say, right, we need to open people's mind to the fact that there can be other things going on. We also hear lots of people's stories about how they've been prescribed, say, a non-steroidal, and they're not seeing any difference. And you're like, alarm bell, OA likes non-steroidals. If it's not responding, have we got something else going on? And do you find that a big part of your workload are complications with the spine, like disease processes with the spine? Is that a big part of your workload?
Well, yes, in the older canine population, yes, that they start to have deterioration of one sort or another in the disc health, and then so that can cause some compression in the spine and possibly of the nerves that are coming out. But I think that too, in veterinary medicine as well as human medicine, it's become, or this typical orientation is so disease focused that we don't even see animals a lot of times until there's a crisis. And if there was a way, if you're doing regular visits or whenever you're seeing the animal for anything, if it's eye drops or whatever, do the physical exam, because what are you picking up here that could be reversed very non-invasively much earlier, so that you don't have these odd and maladaptive compensatory patterns. So by that I mean, that the animal is trying to avoid hurting themselves, or maybe they don't want to walk anymore, so they're becoming deconditioned, all because of a problem that might be as simple as a trigger point in a muscle, so some area of tension, or might be something else. But it can be way before it becomes a crisis, and that you're presented with surgery or euthanasia, unless somebody really knows that you have other options too from the integrative medicine repertoire. But yeah, I think these things just creep up. There are mechanical reasons why, like the spot in the spine, the thoracolumbar region at the end of the thoracic cage here, that's an area of high mechanical strain for the quadrupeds, the four-leggeds, versus us, it's more potentially the low back, so the lumbosacral region. And it's just, that's where things tend to break down. But if we can stay in good condition, if people, were aware about maybe massaging an animal, just as you see things start to go awry, that you keep that idea open about something's not quite right, but not to pigeonhole it into, well, of course it's this or that. But yeah, I think that the assumption that things are osteoarthritis is a pervasive one, and it's very misleading. And I think if you're going to jam your visit into 10 minutes, that it fits nicely into a box, say it's OA, and then you give the NSAIDs as you're saying, and maybe it'll fix it, whatever, even if it's something else entirely, and then the people will just be happy. But
do you know what? It's so good that you said that, because right at the beginning, someone said to me, "Do you not think this is a little bit niche, Hannah? You're going to do this all about OA?" And I was like, well, put it like this. I think so many musculoskeletal diseases are chucked into OA. This platform is going to end up covering tendinopathies. It's going to end up covering IBDD. It's going to be covering lumbosacral. It's going to cover cervical spondylomyopathy, because there is a tendency to say he's stiff, he's walking weird, he's got different posture, it must be OA. So yeah, I think there is a very big tendency to do that. So let's talk about how we actually start getting towards a diagnosis, and then we're going to go through some cases together. Yeah. So we've got 3 cases. We've got Derek, Dave, and Dennis. And one of the things that I think is really difficult is getting those answers. And we were just having a chat before we went live, and I was saying, oh my God, what do you do when you've got maybe hip-related pain, but you've got a real focus of pain in that thoracolumbar region? How can you tell the difference of, is it another primary, such as a slipped disc, plus hips, or is it hips that have caused changes, postural, that's created muscle tension and soft tissue pain, and it's not disc? How do you tell?
Well, and that's again with palpation and observation and potentially imaging. Although, again, like with people, you could get so many of us could get an MRI today, and we might have dehydrated discs along the way. It doesn't mean we need surgery, because that's not where our pain is. And maybe if we did have back pain, it would be in the muscle where we're in our back pocket. We have piriformis muscle, and we've been over, compressing that or something. So it's really about being astute and careful and doing a good exam and history. But from my experience, if they have hip problems, yes, they might be putting some strain on this mechanically, vulnerable area. But we would find, again, when we're examining them, we'd find a lot of tension around here. We'd typically find just hyperactive muscles in the inside of the thigh, because that's trying to pull the limb out, because when the hip degenerates, it becomes too loose. And so to keep that underneath the body, these muscles inside the thigh, the adductors, tend to overuse. So I see that as just an expression of the strain pattern. But if you had a disc problem or just some kind of pressure, some kind of something in that spine, again, we don't know. You could have arthritis in the spine. But what is the actual problem? That takes some investigation. But they would be super tender at that region, typically. Now, if it progresses further, then you might see foot dragging, like to their scuffing of the dorsum of the foot. You might find weakness in the hind end. But again, like you've been saying, these can coexist. And what is the right thing to do? We'll treat early and identify what the problem is. But maybe both areas would improve with NSAIDs, but maybe they'd improve even more with acupuncture and massage and laser therapy and different things. But yeah, once you identify the problem, there's a resonance. It's like, yes, that's where they either want to bite or
yeah, and I think that comes with really quite a lot of experience, in that I'm still very early in my journey, not like you. And I think in my head now, I kind of say, right, they haven't got neurological deficits, so the pain is moderate. I'm going to treat the hips and see what happens with my compensatory changes. If I'm improving my hips, then I should take more tension off of that zone. And if I haven't got a disc related problem, I should see improvement. But if I'm not seeing improvement, have I got another primary? But that's having a really good conversation with the owner and saying, this isn't going to be a quick fix. We're going to work together. We're going to, approach this in a step-by-step manner. And it's like peeling an onion. Things come out to play over time, and they have to just be receptive that it might be more than one problem. That's just how I approach it, especially if they can't afford imaging and can't go down that route.
I guess whatever it would be, that there would be a physical manifestation of both of them. And even if you approached it with medication and it wasn't necessarily spinal cord swelling that might respond better to steroids or whatever, it still might fix both of them. And if we were doing acupuncture or laser therapy or massage, we're going to treat the whole region. I mean, and it's not just the joints, but you're going to see long myofascial strain patterns. There's going to be some neck pain because you're going to be off weighting to the forelimbs, and we're going to find problems in the thorax, the front limbs and the neck. And so that's the beauty of also being an integrative medicine practitioner, is we expect to find the comorbidities or the multiple problems. And in one visit, again, it wouldn't be 10 minutes. I'd prefer a half hour to an hour. And that's how we build our practice. I mean, that's how we structure our practices. Yeah. But it would be addressing all, because even one hip joint won't, of course, act in isolation. There's going to be pain, so there's going to be off weighting. So it's the whole animal approach.
Yeah, I think that's something that is really good to keep reminding people, is if someone's going, I feel disgruntled, I don't feel like I'm getting that same attention, I haven't had those answers from my vet. Do remember, it's not the vet's fault that it's the 15-minute consults. And I think what I would love to see in my lifetime is that musculoskeletal diseases across the board gets more time, because they are complicated and they do need more of an input. So just run through how you would do your exam for us. So you've got half an hour ahead of you, but don't take half an hour talking about it.
Okay.
But you've got half an hour ahead of you.
Yeah.
And the owner's just walked into the room. What sort of things are you doing? Because this is a dog that is very stiff for its lower back and for his mid to lower back. The owner's noticed that he's beginning to scuff his pads. He was put on a non-steroidal by his first opinion vet because of suspect OA, and he just really hasn't turned a corner. So they've come to see you. What happens?
Right. And is this Derek that we're dealing with?
Let's deal with Derek.
Okay. Okay. Yeah. So starting to scuff the.
Just thinking that, just really subtle. He's quite
subtle.
Stiff.
Yeah. Right. And doesn't want to jump in or out of the car anymore, probably, and is more reluctant to go for walks. Well, first thing I would do is meet Derek and watch how he. I want to see them as much as possible. I would rather not see them just in the exam room. I'd rather see them out. I'd like to see them come in to the hospital from the parking lot. How does that work? How do they get out of the car? So as much information as possible about how they move and about their posture. And is the head down? Is the back curved because they're being protective of that?
You know what? You've just given me such an amazing. You collect them from the car. We just don't do that in the UK because we're in a cubicle box room. Generally, there's no windows. There's a table in the middle. We quite often have back to our owners because we're on our computers. The door's over there somewhere, and we often don't even watch them walk in. But do you go outside and kind of collect them then?
Yeah, I that's my preference. Or if I'm still in the hospital and I can see them out there, I would be watching them walk in. Or if they were inside the exam room and I went in there, then I'd say, let's go out, or let's go somewhere where I can do a good evaluation of their movement.
Nice. Like it. So simple. So simple. And it's just dictated by time, isn't it?
Well, yeah, sort of. I mean, like, how did we get here from where we were? Because it wasn't always that vets only had 10 minutes with animals. But anyway, yeah, and I would see them on the floor, so I wouldn't even use an exam table, and that would facilitate them moving about naturally and not being scared about what's going to happen. And a lot of our our graduates don't even wear white coats because that scares the animals. So the more participatory they can be and relaxed, then I can get a better assessment. And I might greet them and say, how are you doing? And even though I am talking to them and meeting them, I'm doing a palpation exam as I'm going. And they're getting used to my touch, and I'm assuring them that I'm not going to hurt them, and I might even incorporate massage, typically I would, with my myofascial exam so that it's comforting as well as diagnostic for me.
Can I just pause it? Because once you start using your hands, like
Yeah.
I've only started using my hands in like the last 7 years.
Mm-hmm.
Can't help yourself, can you? Just can't stop.
Yeah.
You touch an animal and you start doing things, you're like, whoa, sorry.
Right. Oh, right.
Yeah. Touchy-feely.
Well, yeah, I mean, I'm an osteopathic physician, which is differently licensed than in Europe. I mean, my license is equivalent to an MD, so practice medicine and surgery if I wanted to. But so from day one of medical school, we work with our hands, and that's how we evaluate patients, and we see the relationship between structure and function. And so if there's anything wrong with the animal, there is typically some kind of compensatory pattern. I mean, even if it was, I guess, fleas in the ear, they're going to be developing, or not fleas, or mites in the ear, or fleas on the body. There's just, if it's IBD, there's going to be viscerosomatic reflexes. So the body is a record of what's been happening in the individual's life because it's an expression of the system and the physiology. So I'm picking up cues all over, and if there's accentuated tenderness to palpation in the neck, that's interesting. If it was right in the back, all these things. And no matter what the diagnosis is that I would receive coming in, I take that in, but I always want to do my own history, my own physical exam, and so I get my own opinion. But there, again, if they came in with, oh, there's osteoarthritis of the hips, but now we're thinking maybe there's something else, my physical exam should reflect what that animal has. So I'm going there, and then I would do conscious proprioceptive testing with the limbs, and that can sometimes be not done as I would like to see it. So I want to hold the dorsum of the paw down for 2 or 3 seconds, because if you just go like this, then that's not enough time for the nervous system to only use the joint receptors that might be impacted by neurologic disease from the back. So there's a way that you do your neurologic exam. And if there's a lot of delay, or if there is delay in the hind limbs, then okay, we probably have a neurologic problem here. And we might have other things too, but we at least have a neurologic problem. Then I'd say, what's going on in the front limbs? I'd be supporting the body, and then see in the front. And then I would, again, this takes time, but I'd ideally have relaxed the animal so much that being on the side wouldn't be a big problem. And then I would do my tendon reflexes. I would look for cross extensor reflexes. So all these bits of information put together my assessment of what are the likely problems that we're dealing with, and where are the issues. And in the course of my examining the animal, I get a sense of, is there pain? If there's pain, where is it? And what is it from? Is it muscular? So osteoarthritis is saying, oh, it's about the joint and the bone. Well, so much soft tissue is responsible, so much pain is due to soft tissue restriction.
Yeah, definitely. I learnt that the fascinating way when I had a dog that was supposed to be brought in to be put to sleep. And as we were talking, because I was on my hands journey, I couldn't help myself. I was just chatting to the owners, and the dog stood up and walked off, and they were like, wait a minute. I was like, yeah, there's a lot of soft tissue pain, and actually he's not that bad. We deal with the soft tissue pain and he's going to go back to being okay. And they're like, whoa, he hasn't actually walked today. We thought we were game over. And I think people do really think of osteoarthritis as just joint pain, and they don't really look at the bigger picture and the myofascial pain that comes with it. So yeah, totally. Can you just spend a little bit of time telling people what proprioception is, and about the fact that the nerve function in the back end being less on it could indicate that it's being interrupted because of maybe a disc pressing? Can you explain that for people?
Right. Well, even us sitting here, or me using my hands, or if I was standing up, the fact that I would be standing up, all that information is is coming from nerves in the in my body, wherever it is, that in order to accomplish those activities and even do this with my hands or whatever, my brain needs to know where every part of my body is. And so I'm continually getting information from the periphery, so from the outside, into the brain and different areas of the brain that's recognizing the position where my joints are. So there's all these nerves in the joints, in the skin, in the muscles that will tell you where you are, so we don't fall over and we can have good control. Like pianists, I mean, you just have a lot more, and you develop those connections more the more you practice with something, so it gets stronger. So with a dog, as they're walking with their feet, they, instead of scuffing their feet, they need to know where all of the parts of their paw are, so that they can take a step and they're not dragging their foot. And so when there is an interruption, as you said, in somewhere between the brain and the foot, then they might lose the sense, the position sense, which is the proprioception of where their limb is in space. And so they might drag it a little bit, but there's enough working there that they can accomplish finally stepping, but you hear the scuffing. And so the interruption from the nerves can be anywhere. It can be what we call peripheral nerves down here. Some signals aren't getting through, or it can be from the back. But it's, once you see what the nervous system can and can't do, or what happens when it's impaired, then we put together the nature of that impairment. So there are different types of gait abnormalities. It can be from damage to the brain. You can have different types of gait, just imbalances or characteristics. And but when you see scuffing come along, unless it was because that joint was somehow maybe surgically put in a certain place, and it can no longer function, and probably the nerves are damaged also, then that's a tip to you. This is neurologic until proven otherwise.
Yeah, and that's exactly what Tom Harcourt-Brown from Bristol Uni said a few weeks ago when we were talking about lumbosacral. And he was like, a big clue, guys, if there is a drag component to it, if there is a pad scuff, a toe drag, you have to think to yourself, could this be neuro? And I think that's the sort of thing that I see on Holly's Army, where the dogs are walking, you can just see they're not picking up properly, and they've got wide and then narrow and then wide and then narrow placement. You're like, I don't think this is just OA, guys. Right. I think there's something else going on. Okay, so do many of your cases go on to imaging? Because one of the things that's really important to CAM is that we cater for everybody. There is gold standard medicine, which we would love, and everybody would love to have gold standard medicine, but its price point might be out of people's reach. Do all of yours go for imaging, or do you try and do what you can?
It just matters. I mean, we can talk to the client about the pros and cons of imaging. I mean, imaging only tells you so much. Imaging does not tell you about myofascial pain or soft tissue pain. And that might be the biggest thing that animal is encountering. So imaging could tell you what the situation is in the bones and joints to a degree, but it's not required for us to go forward and treat. And what are you going to do? So there's joint pathology there. What are our options? And why would we want to do any surgery at this point anyways? And you can't just carve away the joint abnormalities typically for osteoarthritis. And so we want to have a more functional structure. And so it's not really that relevant a lot of times. If we're then curious, or could there be bone cancer? I mean, it's always something that we can do, and we don't want to not have a diagnosis if something isn't adding up. But if we were to practice and institute a series of acupuncture and related techniques, so like laser therapy, massage, and all that, it's not unreasonable to just do a few treatments covering 2 to 3 weeks and see, is the animal improving? And usually if I'm doing a treatment during that session, there will be myofascial problems. If you have osteoarthritis, let's even give them that. There's going to be soft tissue problems, and that's what's restricting the movement a lot of times. I mean, you might have some bony, changes, but really what's causing the issue and the pain, and it's neurologically driven and it's soft tissue. So with acupuncture and physical medicine, we can start to release that and give them that movement back, and that's going to help the joint health as well. And I should be able to see the changes and the improvements and feel that improvement during the session.
Yeah.
So then I can.
Dr. Ian Self, I have to do a name drop because this guy's great. And
Okay,
I cannot pin him down to come on here. Anyway, Dr. Ian Self quoted as saying, if you have OA, you will always have other pain. And people have to be cognizant of that and shouldn't be downhearted by it. It's another door that you could open to positively influence your dog, So yes, there are different types of pain in different locations when they have osteoarthritis, but you can actually attack those different locations and relieve total discomfort and get a really comfortable dog back. So yeah, that's cool. I'm glad that you also said about imaging. It does have its place though if things aren't going according to plan. And I think again on Holly's Army we see this reasonably frequently where people have been on a management plan and things are just not going according to that plan. So they might be on an anti-inflammatory, they might be on an adjunct, they've done their lifestyle changes, they've done weight loss, they've maybe added some massage or laser or whatever, and the dog's still significantly lame. You're like, get imaging.
Right. Well, and yes, and then where are you going to get the imaging? So two, unless you have the more comprehensive view that the pain could be in a lot of different places. I mean, where are you going to direct that imaging to, or the MRI
I think you're right. You can't just kind of do a full body scan, but if you've got a dog that has persistently had a forelimb significant lameness and you've done all of these alterations and it's still not improving. I think I'm just trying to plant the seed with owners not to be angry at their vet if their vet says, we've tried this, we've tried that, we've tried the other, we've had no change in this dog's pain state. It's still very localized to this left fore. We need to know what it looks like in case there is a bone tumor or something like that.
Yeah, okay. No, I agree.
So now that you've done your exam, we're still with Derek. So Derek is a mild case. What kind of stuff are you going to do with Derek?
Well, I would, after my exam, have a presumptive diagnosis, as we say, and maybe it would be definitive at that point. But if we did imaging as well and it confirmed my suspicion, then we'd be there. But I would talk to the client about the different options, even if I thought, well, maybe it's this or that, but in any event, these are your options for treatment. And it could be certain medications. Probably not for Derek, there wouldn't be any surgery even to suggest. But then I would talk about integrative medicine and sort of an integrative rehabilitative approach, including acupuncture, laser therapy, massage, maybe pulsed electromagnetic field therapy, possibly carefully chosen botanical remedies or other types of supplements, and depending on the body type, would we want to discuss weight loss? Would we want to discuss nutritional changes? And depending on the functional impairments, I might suggest certain exercises or just certain techniques that the client can do at home, or how to modify the home environment. So I'd see what's it like at home? What kind of floors do you have? What kind of other animals? Floors, yeah. And exercise. I mean, some people overdo the exercise, so I'd want to know. I want to know everything, and that's where, when we do have practitioners that go mobile, and then you just spend as much time as you want, at least in the States, that you get to see what that animal's lifestyle is like, and that is so revelatory and useful.
It is. It is. And I think that's one of the things, well, that was what started CAM. If you went back to the original first few posts on our Facebook page, like right back in 2013, 14, it was me taking photos of people's houses, trying to go, well, actually, this 4-foot drop from the patio into the garden where they go for a wee, possibly a little bit much for this dachshund.
Yeah, right.
And it was just like going into other people's worlds, you realize a lot of things that could really exacerbate conditions, and if you remove them, that tissue has a chance to start trying to heal itself. So yeah, totally get where you're coming from there. Tell people about acupuncture. So over here, there are still the cynics, don't get me wrong, but there is definitely much greater engagement in it. And we've got a number of organizations. I've just started studying with the Western Veterinary Acupuncture Group, Sam Lindley's lot, and it's a very neurophysiological approach. And then you've got your more traditional meridian type approach. What do you practice? And can you explain it for us?
Yeah. Well, originally, especially when I learned through the human approach, I learned it all, traditional Chinese medicine, French energetics, and the scientific approach. And then as I entered veterinary medicine and developed my own program, that was my friend that we had talked about Wales a little bit before the show. That was my best friend at the time. He was from Wales, and he was one of the 3 people that originally started the International Veterinary Acupuncture Society. And he then, in 97 helped me get my course started. But by that time, even though I was, had a traditional Chinese medicine approach, whatever, he said how he had, really looked into the neurophysiology and everything, and how it was nerve based. And I was like, and you mentioned about being an ex-smoker kind of, feeling about it. And at the time, I still believed that it was energy and chi moved through the meridians and everything. And he's like, no, it's not. And I was so mad at him, and I wanted to disprove him, and I couldn't. There was no way to show that things were chi. And then the more he told me about things, and it's like, wow, it's like, I think you're right. And I had always loved and studied a lot about the nervous system, and had at one point planned to be a neurosurgeon in human medicine, and just all these different things. And then when I made that switch and I looked at the history, and just there were so many myths that dropped away, and even to see that the Chinese people who did acupuncture, there were lots of neuroanatomical acupuncture papers coming out from China, even in the 80s. And then just seeing that, okay, here's what makes sense, is that if you have an acupuncture point somewhere, and you stimulate the nerve where that is, that neural action, so that the action that nerve has, the job it has in life, is consistent with what the Chinese were talking about when they were, speaking in metaphors. And so metaphors might have worked in the pre-scientific era, but now 2,000 years later, 2,500 years later, we understand how the brain and spinal cord and nerves work, and can explain this more precisely, and then have more specifically attuned results that we're looking for, and we can measure the progress objectively. We can measure nerve function objectively. And so when I spent 15 years writing my human book, which is 7.5 pounds, it's a human acupuncture atlas. It took me 15 years.
What?
Yeah.
Oh
yeah. That's what really sealed it for me, is because when I started that book in 2001, I was still like thinking chi, blah, 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 but also nerves. But then when I went through each point, 360 plus points in the human, for each point, the innervation from a sensory, motor, autonomic perspective, that it's so rich with the information about how the physiology can change when you activate nerves in a certain region. And so that's what caused my transformation. I changed my course completely to be strictly scientific. And I have very little patience for the ex-smoker part. The ex-chi believer part is that I have very little patience to say that any of this can't be explained scientifically, because it can be if you know enough about neurophysiology physiology, neuroanatomy, and then adding in the connective tissue piece, the stretch on the different fibroblasts. I mean, I don't want to get too deep into the physiology.
Another day.
Yeah, but the myofascia, I mean, that's another piece that we engage with the acupuncture needle. And that's why the results are so profound, is it's working on so many different layers, from a functional aspect and from even tissue aspect. We're working with the skin and all the different muscle layers and the nerve centers and everything. So it's great, and you can always learn more because there's so much more information becoming available with how acupuncture works and how it all comes together.
Yeah, as you say, the science is really growing.
Mm-hmm.
Just for any people that are watching, just basically, because when I'm trying to teach like owners who are interested, I'm like, well, we've got a little bit of the pain gate theory going on here. We've got a little bit of endorphin release. Could you just touch on just a couple of those things so that they have something tangible to walk away with from what does acupuncture do?
Yeah. Well, I'd still stick with the nervous system and the soft tissue. So, so when you have the restrictions like we've talked about, and I don't know if Derek has this too or not, but he probably would have some tension in the back and some restriction and some tenderness to palpation when we get there. And it's probably in various regions that makes sense with where his problem actually is. That when we would stick a needle in the certain area that especially seemed tender to him or tight, that needle is going to go in and it's going to just help the muscle tissue relax from a number of perspectives. It's going to calm the nerve down that is supplying that muscle. And it's going to stop this reverberating feedback from the muscle tension that's then sending signals to the nervous system that are then going like, I'm so worked up now because I have all these impulses of pain coming in. And then they're going to, then those segments of spinal cord that are receiving all this agitation, then they're going to be like, yeah, I'm agitated too. Let's clench down on that muscle. And so it's this positive feedback loop that we can interrupt by a lot of different, chemical and just physiologic nerve-based mechanisms at the site. But it's not only things that are happening there, those signals, because you would recognize where an acupuncture needle was and how it was stimulated. That means because it's come all the way to your brain. And so there are effects where the stimulus travels up the spinal cord. There's changes in the spinal cord to just calm that down. There's changes in all these different centers of the brain, because we can watch the human brain as the person's getting acupuncture and see how pain processing centers are just changing, calming down, that there's more of a sense of peace. You just see things light up. And so you're changing the way the whole organism is functioning, even if you are doing certain local points. And so it's so multifaceted, and you just don't get that kind of restorative, homeostatic kind of effect when you're giving someone drugs or when you're cutting in with surgery. It's a different kind of treatment. And so medical acupuncture and related techniques tend to be very nourishing to the system, very strengthening. And just the final thing that I would say, especially coming from my osteopathic background, is we learn about how the body and mind have our intrinsic self-healing mechanisms. And so, like you said, with the endorphins and all that, that's all part of our innate capacity to heal, to recover from pain. And it's just making use of that in a very informed way.
I think that's a brilliant phrase that isn't said enough, is nothing can make you heal, it can help you heal. And I think people got to realize that we have the most amazing content in us. I love talking about this in the form of how we can affect perception of pain by distraction, by engagement, and all of these really brilliant owner and dog related activities. They're not sprinkling of icing, sugar and cherry on the cake. They're really important. So engaging with your dog, doing really good, fun, pleasurable activities, getting their brain working will distract them from that pain and create a great brain space that can deal with pain better. But yeah, I could go on about that.
Yeah, me too.
So what about Dave? Okay, so Dave, we've done Derek, and we're now on to Dave. And Dave actually has got some significant neurological deficits. So he's got moderate pain, and he really is scuffing. He's got really his toenails have been worn away. He's missing the fur on the top of his pads where he hasn't broken the skin yet, but we're not far off. And it is mostly right-sided, so a little bit on the left, but more dominantly right. So you're seeing him doing drag, basically.
Okay. Yeah. Yeah. Well, if he's that bad off, and if that is from the back, then we've got definitely some back involvement. But if you're just saying that Dave comes in and he's still got the diagnosis of osteoarthritis.
Still got the osteoarthritis.
Yeah.
So he's another one he's been on a non-steroidal course for the last 3 weeks. So they really haven't seen a huge change in how he presents himself physically. He's emotionally a little bit better.
Yeah.
Like a little bit more engaged. And he's like, yeah, okay. But he's still got this disability that hasn't improved.
Right. Well, I mean, that's getting more and more obvious, right? Because just having arthritis doesn't make you do that and scuff. I mean, you still might do it, but but you have other problems as well. So, yeah, that's when.
I think people think because you have muscle wastage with OA. So if you've got a painful joint and therefore you use it less, so therefore you start getting what we call disuse atrophy of the soft tissues, you are going to get weakness. And so I think a lot of people expect to see weakness so they don't question the more proprioceptive deficits. And that can be quite hard, can't it? Deciphering between the two. But no, he's definitely been dragging. So
well, yeah, and that's not weakness. Just weakness doesn't make you drag, especially on one side like that specifically. I mean,
bing, bing.
yeah, but again, there would likely, if it was from the back, I mean, it could be anywhere between the two, but if it was from the back, then Dave, I think we're talking about
with Dave, yeah,
would also potentially be more aggravated with other animals in the household because he doesn't want to be bumped into. So when they start to have back problems, they're very protective, and so there could be maybe some aggression that hadn't come up before, but also again more reluctance to do things.
Would you change your treatment plan? Like, so we've mentioned acupuncture, we've mentioned massage. I should imagine do you use heat sacks and do you use like thermotherapy and stuff like that?
I wouldn't use. I mean, heat is an option in certain cases, but I wouldn't use that in this, especially without knowing where the problem was, and oftentimes there's inflammation, whether it's arthritis or a nerve problem. But I wouldn't want to bring heat and edema to an area if it could be neurologic too. And so I wouldn't use that, but I would definitely use some photomedicine, so typically laser therapy, maybe light emitting diodes. But that's because I would have tried to nail down the diagnosis as much as possible. And if I'm suspicious of a back problem, then I think, okay, what is the problem? I have a neurologic deficit here, so there is likely something compressing the spine. So if I've gotten to where my neurologic exam is consistent with the spinal cord injury of some sort, some compression, I could still consider, is it neoplasia? We could still think about that, but I don't know. It's less likely, but if we're not going to go through imaging, I would do some acupuncture, and I'd think about what can I do to improve nerve health. And so that includes the acupuncture. Maybe there's electroacupuncture, electrical stimulation through there. But again, the laser therapy is going to be rejuvenative to the tissues there, and anti-inflammatory and pro-circulatory and pro-nerve growth. So that's where, again, it starts with your presumptive diagnosis. And what do you think, based on the information you've seen and all the problems, other things that it could be, how do you help narrow it down to your more putative or probable diagnosis? And so what's the pathology there? in the muscles, in the nerves, in the bone, whatever it is, and how can I benefit that with my integrative therapies? So the ones I've mentioned, maybe some exercise, and then consider botanical support as well, if that's indicated. And
that's a lot that you're juggling. Yeah, can you a little bit about photobiomodulation, just a little bit, and then because we're already at 50 minutes.
I know. Yeah. So laser therapy is, I use photobiomodulation because it's delivering photons, so light to the tissue, which reacts to the light coming in. So the tissue is the bio, and then modulation is it, just like neuromodulation with acupuncture, bringing things back into a balanced state that's more healthful. And so when we have something like laser therapy, where it's not cutting, it's not injuring tissue, but it's actually supporting it, light of certain wavelengths, oftentimes it's near infrared, so we can't see that wavelength, that can go into the tissue, and it just, we can say in a generalized way, it kickstarts the metabolism of the cells. And so when tissues and cells are sick, are stressed, are weakened, are in a chronic state of just disarray, the ability to do the activities of normal living for a cell are diminished. And so part of that is creating just that cellular energy. We're not talking about chi, but the ATP, the things that the cell produces that get things going, that help it produce the growth factors and the ability to divide and repair and all those things. And so so the light comes into the tissue, and it's at the mitochondria level. So those are those cellular energy little engines in the cells, that they awaken, and you just start getting the metabolism into gear so that the tissue health will improve. And because we're oftentimes stimulating cell repair, then you need all those growth factors. And that's where, if you have a nerve injury, that it's been shown, whether it's a peripheral nerve injury or spinal cord injury, that on so many different levels, you're helping that tissue repair. And there's a lot of overlap between how photomedicine works and acupuncture works. And one of the end things, both of them help to activate the stem cells that we have already in our tissue. So I know there's stuff about stem cell therapy. We already have them kind of hanging out in the tissue, but with acupuncture and laser therapy, we can awaken those. So it's like, yeah, get back to work. Let's get some things fixed here, and restore that structural integrity to the degree that we can.
Yeah, I was going to kind of go class 4, class 3B. I am not going there. Let's move on.
Another time we can do, maybe.
We can do another. I think that's one of the lectures I listened to you, which was
with online pet health. Yeah.
Okay, so because we're running out of time, let's talk about Dennis, because this is a different category. So Dennis, who's mates with Dave and Derek, they had a terrible threesome.
Right, and they look alike.
They look really alike. Dennis has got severe pain. So he is really uncomfortable, and he has got significant neurological impairments. He's slightly urinary incontinent, and he's both legs scuffing, significant.
Yeah.
So what would we do in these situations?
Well, so in this situation, I mean, you still have the same options, but I know that a lot of people would possibly recommend surgery as the key approach right away. And I mean, we could debate the pros and cons another time, but I would still want people to know, okay, if we go to surgery, what's the goal? What are the benefits we expect, and what are the risks? And yet, even so, I mean, if there's pain, we can control the pain oftentimes in the immediate section. So if somebody said, no, surgery isn't an option for financial, for whatever option, whatever reasons why, I just want to do, acupuncture related techniques, then we'd say, okay, well, maybe we want to start with some medications as well, and just get a handle on that, and see, do we want to add any steroidal kind of addition that can be controversial sometimes, but that might be indicated. And so we can control the pain in the early stage here and throughout, but let's get the nerves back to work. So again, we could explore the risks and benefits of both. The risks are much less with an integrative approach. And
it's definitely a topic. Like if I put
Yeah.
you in a room with a neurological surgeon,
Right.
there will be very different thoughts on this. And I think before we went live, we decided that the safest, most comfortable situation is this is about conservative management. Yeah. These people don't have the option of surgery.
Right.
That door isn't closed,
Right.
i.e. they can still do some amazing things. So I think that's where we were kind of standing on this one. Just out of interest, so Catherine just says, would you not recommend pain relief for these dogs? Well, these dogs were already on a non-steroidal because they were perceived to have OA. So they had a background anti-inflammatory. Do you use any of the Western-based approaches such as gabapentin, pregabalins, etc.?
Oh, yeah. Yeah, no, and that's where I said with, who's this now? Derek, Dave? Dennis, yeah, okay. Yeah, no, that's what I said just now, that we'd probably want to start adding in some pharmaceuticals just right away to get us through a certain period of time. And yeah, they could be on gabapentin. I mean, we'd see how they do. And if we're doing acupuncture and photomedicine and all that, then they may not need as much as animals would typically get. So
how often would you do these therapies? Because I know for me, when I'm trying to talk to owners about their role that they're going to play with their dog, so say we have got intervertebral disc disease type 2, we have got some neurological deficits, we have got pain, and I'm having that chat with the owner saying, right, if we go down this route with a rehabilitative approach, if you're going to do acupuncture, you're going to be looking at how many times per week. If we're going to do laser, how many times per week? Because that can really change whether somebody can buy into that, isn't it? So what kind of timescales are you doing for Dennis, severe Dennis?
Yeah. Well, and it would matter, are they intra-hospital or not? So if I was treating them in the hospital, and there's always that specter of euthanasia, because I've worked on plenty of animals where if she doesn't walk within, let's say, a week, then we're going to euthanize. And so then there's the negotiation: do we want to do it every day while they're in the hospital or not? But if we were outpatient, I'd again, real severe case and specter of euthanasia, I might say 2 to 3 times for that first week. But I'll also receive diagnostic, prognostic information when I'm treating. So how are the nerves responding? What is the status of the nervous system that I have to work with? But then tailor it down or titrate it down ASAP to where we can maintain progress or even get more progress without having a huge amount of visits. So maybe 2 or 3 the first week for a really severe case, and then maybe 2 the next week, and so on, and keep it down. And then do we need to have maintenance? And I would educate the client, here's when you need to come back in. If we were out at the maintenance, and I'd say, do you feel areas of heat? Is the dog slowing down? Are they acting more painful and all that? But yeah, I mean, pharmaceuticals can play a role, but too much on that, I mean, those have risks too. And that's where sometimes a botanical approach can help to reduce the reliance on just drugs.
Yeah, we did. So followers, if you really want to have Narda come back and we'll talk about things like the botanicals, and just please, request it and I will beg her. But already looking at the time, we're at 58 minutes and trying to delve into botanicals and herbs and stuff. Whoa! We had Chelsea Dawson on a few months back. We've had Bela, who's talked to us about it before. So there are Facebook Lives about that, but we'll persuade Narda to come back. Before we kind of wrap up, we've been talking about what we call modalities, which is your laser, which is your acupuncture. But there's also definitely applicable to OA or spinal disease. Weight control, guys, weight control. Home environments. So Narda touched upon it. Please don't underestimate the impact of the environment that we ask our dogs to live in. I know I have a gigantic bee in a very small bonnet about this, but it's just so obvious. I think you probably feel the same as I do when you go to people's homes. You just sit there going, it's not helping.
Right. And I'm fairly forthcoming with it too.
Do you actually say?
Oh yeah, because they want to know, and you just get blind to things. And I particularly don't like it when people are riding their bike and pulling a dog on a leash. That's my more amazing hornet in my little bonnet.
And I love the hornet.
Yeah.
these pathological flying things are just getting
Yes.
bigger and nastier. No, so yeah, please don't overlook lifting and support devices. You know, helping your dog is really, really a big part of the plan. Should we just do? We're not going to talk about cervical and lower lumbar because I think we're just going to open a can of worms if we start moving our problematic area up and down the spine. But let's take a couple of questions.
Sure.
This is from Denise. Now she put one up here, and let's start with this one. My dog has a cyst on his spine and the vet wants to operate, but says it might make him worse. But he's in no pain. He's on steroids, hydrotherapy on treadmill, physio, massage, laser, treatment to see how he goes. Then she says down here, if your dog is not in pain and cannot walk after spinal surgery, would you recommend wheels? So obviously there's a lot of stress going on for Denise because she's got kind of like a big decision to make. What's your thoughts and how can we help her?
Well, on the not walking and recommending wheels, I think that's a suitable thing to consider and recommend. But I mean, even at our last rehab course that we had here, we had a dog that had been using a cart for years because the parents had been told she won't walk again, and we were getting her standing, and I think just in the one little session she hadn't ever stood on her own since the injury. So my recommendation is to find somebody that does a medical acupuncture scientific approach and rehab, and see, like, if you haven't tried that already, there are things still to try. But if you get a properly fitted cart, then you can help them out in the meantime. But there might still be a lot of healing potential there that has been untapped.
Yeah, I think that's exactly what I was thinking. You know, the cart isn't the end of the road. It might be the road to the new end point. So it's worth the investment as long as you say it's not putting any more tension on there or other areas. But it could be part of your rehab plan rather than, this is what I've been left with.
Right.
Love it. We've already got people saying that they want you to come back and talk about botanicals. Where's this? Here we go. Is it common for a dog's tail to atrophy and start to die with disc degeneration in a 12-year-old dog? And then she says, my vet is recommending tail amputation.
So with disc disease, is there confirmed disc disease? I guess I would wonder. A lot of times the tail does exhibit changes when we have neurologic problems in the spine. And but starting to die, I mean, if the tissue is actually necrosing or dying and there's no circulation there, then that wouldn't be healthy to just leave it there. But if it's a matter of that there's not really a lot of movement, that's one of the indications, again, for acupuncture, where it's so responsive to stimulation, and it's great to show people that where there was a tail that wasn't able to move because of neurologic consequences in the spine, that we use some needles in there, and even within one session can oftentimes just start to wake that up, just because the nerves are so accessible there. So
it's strange that it's dying off, though. I was like,
if it's dying off, then yeah, that's not healthy.
No,
to have a dead tail, actually.
Yeah, whether that's all disc disease related, though,
that doesn't sound right. Like maybe if a tail got caught in the door and it really was broken and the blood vessels weren't there, I mean, that's kind of an unusual thing, but
it's very unusual. What's this one? If a dog suffers from osteoporosis and has kidney failure stage 2, which means he can't take NSAIDs, what's the best way of dealing with pain, please?
So the best way, well, there's tons of options, and there's lots of physical medicine options. Biomodulation, again, laser therapy is good for the bones, it's good for the kidneys, and then I mean, is there pain from the bones? So I'd want to do as much that can benefit the health of the entire dog as much as possible. So so I would want to think about that. I'd want to think about pulsed electromagnetic field therapy, so you can get beds that they can be on that just create an electromagnetic field that improves tissue health to some degree as well. There are potentially herbs. There are certain herbs that can actually be pain controlling, but also conceivably benefiting the kidney instead of injuring it. So again, it's this multimodal treatment approach.
Totally multimodal. And there is so there are other pharmaceuticals, and there's also, if you're based in the UK, we've now got the monoclonal antibody, which is a completely new approach. Have you got that over there yet?
I'm not sure. I mean,
have you got so over here it's called Librela by Zoetis, and it's a monoclonal antibody against nerve growth factor.
Oh, yeah, people are talking a lot about those. Yeah, those approaches. Personally, it just doesn't interest me as much, because I always worry. I mean, not that it's a bad thing, but I always worry about the consequences of altering a physiologic process that is in our body for a certain reason. So, but yeah, I mean, options to try.
Yeah, well, that's the next question. So I'm interested to know if the new OA drug Librela can also be used for dogs with disc disease. I haven't heard anything. I can certainly contact Zoetis and look into this. I'll write it on my list to do. Looking at the theory behind it, obviously Librela's release is focusing on nerve growth factor, which is a peripheral receptor sensitizer. However, nerve growth factor has many other roles to play in the central nervous system, and maybe it does have a role here, but I haven't heard of any trials that have been using it for disc disease. But I will put it on my little notice list and see.
Yeah, I mean, I'd be curious. Like, nerve growth factor is helping nerves grow. So if we're looking at spinal cord injury and nerve repair, then why would we want to inhibit the growth factor? Those are my considerations in terms of approaching illnesses from a modulatory approach. So neuromodulatory, with acupuncture as one of its mechanisms, is helping the body recover without pushing it one way or the other, but to helping it get back to normal, which is a balance of inhibiting and stimulating different processes.
Yeah, and I think it is difficult, because there is part of your brain going, oh, I just don't want to make it worse. But just to support Librela, what we're seeing so far is we're seeing quite amazing results in a lot of dogs. But I think we've still got a lot to learn. Definitely.
Yeah.
Somebody asked here, do you have a suggestion for the best PMF? I've done a ton of research into it, but I'm still unsure which is the best one to go with. So I have analysis paralysis. I love that. My 14-year-old Sheba has hip dysplasia and pretty severe arthritis. You'll actually help me deal with this, because I've got a little bit of a challenge here. My dog settled very well on PMF pads from Westville. So we have something called the Biomag. It's a Westville mat. And Holly, when I had her, she just relaxed. It's almost like she melted into the floor on it. But when I've looked for solid clinical research of its pain relieving properties, what I've read is using it so much throughout the day for it to be clinically beneficial that using it for 10 minutes once a week just didn't kind of fit the methodology of the trials. How often do you use it to kind of hit those clinical trials that we refer to, where they're being used 6 hours a day for the last 20 days? What's your scope on it?
Well, I it's hard to generalize the research to all of the devices, because they have their different parameters. And I don't know if you have over there the Azizi loop.
We do.
Okay.
And it's more targeted, isn't it?
Yeah. And so, that's very focused. I think they're making, though, pads now too. There's also a company, Respond Systems, which also makes lasers and the pulsed electromagnetic field bed. So there's like 4 coils, and that's where if you wanted it over time, you would. I mean, they could sleep on it. They could just rest on it. That's where they are. But I mean, there are a lot of different types and strengths that we have over here, and but I think that in order to provide that long-standing exposure, that you would need something they could pretty much lie on and hang out with.
Yeah,
So,
yeah. That's the only challenge I've had with it. Like I love the concept of it. I've loved what I've seen with it. I think, as I say, over here we use Westfield. That's a very big brand over here. But it was when I was looking for solid evidence to support. I was like, wait a minute, what I'm doing once a week for 10 minutes ain't anything like what's happening in that study.
Right. Yeah. And over here, I mean, the Azizi Loop company, they've really pushed the research, and so they're getting some studies out. Respond uses more the results from some of the human literature, and then we just kind of extrapolate.
Yeah. We definitely need a lot more work in that area.
Right.
So difficult. Right. We've been going for an hour and 10. Love.
Okay. Yeah. Right.
I would say just the massive thank you, but I'm going to do that after I do a very quick pitch about something that CAM does. I think most people realize that CAM is self-funded. We don't get government grants. We don't get funding from any other charitable source. And we rely very heavily on creating our own financial support, and it's getting expensive. The more we grow, the more we spend, and our overheads are beginning to hit $2,000 to $3,000 a month with ease at the moment. So we fund ourselves by creating content, independent, non-biased content. One of them is the CAM Advocate Level 1 course. It's 12 modules. It's online. You can do it at your own pace. It's designed for canine professionals. So you might be a dog trainer, you might be a behaviorist, you might be a kennel assistant. All of these, dog groomers, dog walkers. It's pitched for you guys to give you a much greater understanding about this disease and how you can best manage it. And all proceeds go back to CAM to keep us going. So if you want to know more, I'll put a little bit in the thread about it. It's at our education centre, www.cameducation.co.uk. Narda, you're lovely.
You are too. Thank you.
Thank you so much for giving your time to us. It's really, really cool.
Happy
and
to
I think from what I'm getting the impression is let's get you back if you ever have time to talk a bit more of like the herbs and the botanicals and your approach with that. That'd be fab.
Of course. Yeah, I'd love to whenever you want.
Thank you so much. So thanks, guys. We're going to be back next week. Next week's a big week. Oh my God, it's a massive week. We're Tuesday, Wednesday, and Thursday next week. So go and look at our events list and sign up. We have got Professor John Innes, and I've been trying to pin him down for 6 years, and I have finally backed him. So he's going to be here on Wednesday. Until then, we will see you next time. Bye.
Bye. Thank you.